Hi everyone, my name is Barbara. I'm a registered nurse. I work at Arundel Medical Center as a nursing director on the heart and vascular unit. So as I said, when I volunteered as a candy striper one summer in high school, I just really felt that that's where I wanted to be, is to be helping others. And going through the nursing program, I worked as a nursing assistant at a local hospital, which really helped me. I also worked in the lab at that local hospital, which really helped me. And so when I graduated, I felt prepared, not as prepared as I could have been, but prepared to start as a registered nurse. And I just kind of moved up the line. I loved the bedside nursing, but when I became a nursing supervisor, I found that I really liked operations and the global perspective. So that's when I went back to school to get my master's degree. And now I'm a manager, a clinical director, and I really love the profession. I love the fact that it's so portable, that you can travel, you can always get a job. And there's so many opportunities if you want to go back to school and become a nurse practitioner, a certified registered nurse anesthetist, a midwife, an educator, a professor of nursing. These are all opportunities that are available to you. It's a wonderful profession. We go from birthing babies to holding someone's hand as they're taking their last breaths. So it's a calling. You have to be called for this profession because you're taking care of people at their most vulnerable stages of life. So I feel privileged. You have to be compassionate. You have to love people, and especially in nursing, you have to be detail-oriented. So, and like to multitask, because we do a lot of multitasking. So, like we talk to the students about having a patient that's really, really ill that you think might not make it through their hospitalization, and then seeing them able to go home and resume their life with their family. It just makes you feel good at the end of the day that you helped somebody and you made their life better. So you can actually go to a community college and get your associate's degree and graduate in 2 years. The hospital I work at will pay for you to go back to school and get your bachelor's degree. Or if you want to just go straight through, you can actually go to a 4-year university and graduate with a bachelor's degree in a BSN, Bachelor of Science in Nursing. And then of course, either track, you have to sit for the Maryland Board of Nursing, the NCLEX, and pass that, and then you get your license. There's many, many avenues that you can take. My advice would be to spend some time shadowing either in the hospital or a clinic or an outpatient center or in the OR if you think you want to go into surgery. And I think volunteering or shadowing and finding a mentor is a great way to see if that career path is really for you. So if you're thinking about it, you should find yourself a mentor or volunteer to do a share day or a shadow day or do a summer volunteership.